I'm Leigh Terwilliger. I'm the nurse practitioner with urology for the Florida hospital Zephyrhills, and we also work out of Wesley Chapel. Dr. Lewis is the urologist. He's fabulous, Johns Hopkins trained, and we love to have well-trained urologists. Now, my background, I did 4 years at USF in urogynecology, which some of you might not know what that is. I didn't even know what it was when I started. Basically female pelvic issues. So I did a lot of work with female incontinence, female prolapse, female UTIs, female. And in April, I joined Dr. Lewis, so now I do males too. And I love urology. It's my passion. Leaking, chronic UTIs, incontinence, all of that. Just a huge passion for it. So today, I'm here to talk about diabetes and your bladder. There's a lot of, I'm sure you guys hear a lot about diabetes and your kidneys, yeah? Diabetes and your eyes, diabetes and your blood vessels. Probably not as much talk about diabetes in your bladder, but it absolutely does affect it. Do you guys know that November is Diabetes Awareness Month? Did they talk about that? Diabetes Awareness Month is November. So it was also just a bigger honor for me to be here, but the official little ribbon is gray. Sometimes it's gray and red, sometimes it's gray blue, but just happy Diabetes Awareness Month. And so this month is for you. October was all about breast cancer, so you guys have your own month. So just a little facts, I'm sure you know, 26 million people in the United States suffer from diabetes. That is people who are diagnosed. If you count on the people who are not diagnosed or who are borderline, it's 100 million, so a third of the population. Yeah, I know, when I looked that up, I went, wow, third of the population. So it is a very big concern. It's one of the leading also causes of mortality, of death, and of sickness. So diabetes is the leading cause of blindness. It's the leading cause of kidney failure. It is 2/3 of diabetics will die from stroke or heart disease, so pretty serious. 60 to 70% will suffer nerve damage. Now, remember that. Nerve damage has a lot to do with the bladder, and that's one of the reasons it does affect the bladder. The nerve damage that most diabetics will feel is in their feet. Anyone got tingly feet? Yeah, tingly hands and feet. Well, if you think about it, the pelvis is kind of one of those extremities also. So the plan for this discussion, so I have to stay on course. If I get off course, someone might want to go. Number one, in early diabetes, how is the bladder affected? So that's number one that you guys should be able to answer by the end of this. How does damage to blood vessels affect bladder function and health? So diabetes does damage the blood vessels, and how does that affect the bladder? And then once nerves become damaged, what happens to the bladder's ability to empty? So Polly wants some water or bathroom. So these are the polys of diabetes. As a provider, when someone comes in, they're like, I'm thirsty and I'm peeing a lot and I'm hungry and I don't know what's wrong. And we think, oh, poly. Polydipsia, which means lots of drinking, which I like that, dipsia. It's like drinking. Polyphagia is eating a lot. And polyuria is peeing a lot. So the increase in blood sugar, and why does this happen? Well, sugar loves water. And when you get a lot of blood sugar in your veins, the water follows it. And the water follows it and it gets in your veins and it goes to your kidneys and you produce more urine, you produce more urine, you produce more urine. And anyone who knows when their blood sugar's high and they start peeing a lot, that's actually a warning. It's like, oh, I just went to the bathroom, maybe I should check my blood sugar. So in early diabetes, that's what happens, and that's how the blood sugar actually does. And it is because the sugar attracts water. It's a process of osmosis, where water travels across a membrane to dilute. So it's trying to dilute your blood. It's like, come on, we don't need that much sugar in there. So how is this going to affect you? Okay, maybe going to the bathroom more, but also leaking. A lot of people with new onset diabetes will also start leaking. Because their bladder's getting full faster. They're not able to hold it because it's actually fuller. Infections, having wetness down there because of the leaking. So there are some things that can be uncomfortable for the new onset diabetes and even later onset. And we'll talk a little bit more about infections the further that the disease progresses. But there's the answer to the first question, how's the bladder affected? Fills up a lot more and sometimes will lead to some leaking. Any questions about that? I wish we could train Paris to go to the bathroom and the toilet. I might actually have one. I love this. Damage to the blood. How does damage to the blood vessels affect bladder health? I love this slide. I probably should give the person credit. basically these are like little sugar molecules chopping at your blood vessel. I heard a speaker one time say that high blood sugar is like sandpaper in your veins and arteries. I don't know if you've heard it that way, but it's very damaging. It's like just constantly damaging and damaging. And what happens is enough damage happens and you're not getting blood flow. I'm a big fan of blood flow. I don't know about you, but I love blood flow. I like it in my brain. I like it in my feet. I like it in my hands. If anyone touched my hands right now, they're freezing, so I don't get a lot there. But really, I love blood flow. And actually, blood flow is the key to a lot of things. It's the key to healing. It's the key to just health. It's a key to rejuvenation. So a lot of things with blood flow. So when we damage those tiny blood vessels, and honestly, I tried to make it the tiny bubbles, but I couldn't rhyme it like the song. But the tiny vessels, not only in the kidneys, not only in the eyes, but also in the bladder and the pelvic floor. Those are tiny vessels too. And the decreased blood flow leading to the nerve damage and muscle atrophy. Now, muscle atrophy is basically like muscle weakness. So you start losing blood flow to these areas, and all of a sudden the muscles aren't going to work as well. If you're working out really, really hard and you get like a Charlie horse, the muscle doesn't work as well. Well, if you're not getting blood flow down to the bladder and the urethra, those muscles actually start to starve. So that's one of the, something we don't talk about in diabetes, because we really are more concerned about the kidneys and the heart and the eyes, because that damage happens before you even know it. You're like, what? But when you're having these problems, just think, oh, this might be why this is happening too. And keeping your blood sugar under control obviously does help. But the nerve damage comes from decreased blood flow. Decreased blood flow to those little nerves out there, and you start losing feeling. Your feet start getting tingly, hands start getting tingly, bladder, urethra, maybe not feeling like you have to pee all of a sudden, or maybe feeling you have to pee a lot, or maybe having pain down there, trouble with sexual function. All of those are related to that nerve damage and the blood vessel damage. So little things that can happen. All right, nerves. Does anyone know who that is over on the left? Anyone know who that is? It's very small. It's Elaine from Seinfeld doing the Elaine dance. Do you guys remember that? It was very uncoordinated. It was very silly. If you want to look up something funny later, Elaine dance. So the two thing with the damage of the nerves. So you get the decreased blood flow. The nerves get damaged. So this is number 3. How does that affect your bladder? Well, we know how it affects your feet. Again, I know I'm talking about feet a lot, probably because my feet hurt. These shoes are too small. But it does affect your feet. We know that. You have to have your feet checked. You need to go to a podiatrist. It affects the bladder the same way. And there's 2 kind of basic types. You got a neurogenic bladder and a dysfunctional voiding bladder. This is the one, and this is the word that people always remember from this slide. No catheters. Your neurogenic bladder, basically the nerves are damaged to a point that your bladder does not empty. That little signal from here to here that says, okay, we're safe, we can empty, and the bladder goes, that nerve signal is actually lost. And the bladder does not contract, and it just fills up and just doesn't do anything. We got this little floppy clock, just like, it's holding, but it's not emptying. Now retention, can be very dangerous, but also leaking can occur. You fill up something a little too full, and you don't empty it, and if the urethra has lost blood flow, has lost its nerves, the muscle has gradually stopped, those little sphincters aren't working exactly the way you want them to, and you start to have leaking. Now, if any of you ever go to a urologist office, they're going to do a bunch of tests on you. We do urodynamics and cystoscopy and voiding diaries. The reason is it's so important to know, is it this that's causing your leaking, or is it just for women because you had a 10-pound baby? It's real important, because if you treat one, if you say you treated stress incontinence, someone's coughing, laughing, sneezing, they're leaking, okay? That's very common. If you treated it like that, this could be worse, and it could be permanently damaging to the kidneys, because you got that urine just backing up. So this is the one that people will end up with catheters or intermittently catheterizing because they're not able to empty their bladder. Neurogenic bladder. Dysfunctional voiding. This isn't actually just for people with diabetes, a lot of people have dysfunctional voiding for various reasons, but this is actually from the nerves being damaged and the blood vessel damage and the muscle damage. So just an inability to empty and hold. The nerves aren't transmitting. It sounds a lot like neurogenic bladder, but actually the bladder is still contracting. It's just not coordinated. So you got to go to the bathroom. I'm big into like, imagine you're going to the bathroom. So you have to pee and you're running in there and you sit down, nothing. And you push and you do this, nothing. And then you stand up and it all comes out. That's kind of like dysfunctional voiding because your bladder wasn't really listening to when you sat down, and you probably weren't, you weren't relaxing. And I'm not accusing you were, but you weren't relaxing the muscles, because the signal relax muscles, pee is what is supposed to happen. Sit, relax, pee comes out. The dysfunctional part is you sat, the muscles, you said relax, but they're not relaxing, and everything's kind of cattywampus. You guys know that word? Cattywampus, and it's just not helping. The pelvic muscles, just like everything else, lose their coordination, and it is actually more treatable. And here's where I like to plug our facility. We actually do have pelvic physical therapy, which can help with a lot of bladder problems here. Reveille Pelto is one of the physical therapists who's actually has a specialty in pelvic health. So it sounds odd, like really? A physical therapist is gonna do something down there? They help, they really do. So once the nerves are damaged, what happens to the bladder's ability to empty? It is disabled, sometimes permanently, sometimes it can be fixed. Any questions about that? No? Okay. It's almost like things getting numb. This is a very boring slide. I couldn't find a picture. So the damage is done. So we're gonna go to, diabetes, blood sugars out of control, or sometimes they are controlled and you just can't help it. It's not, we're not here to place blame on anything. But when the damage is done to nerves, there's not a lot of regeneration that can happen. Nerves don't really regenerate. Muscles can, and they'll make different pathways, just like in the heart and other places. Your body will try really hard to accommodate and to rebuild sensation, rebuild blood flow. But basically, once that damage is done, you can have that leaking. This is the part that's uncomfortable, that you notice, that you go to the urologist for. Very few people go and go, I think my nerves are a little damaged in my bladder. Could you help me? It's usually at this point. Urge is that I got to go to the bathroom. The leak, the stress is that coughing, laughing, sneezing, and then without sensation. Now, without sensation, why should you, if you're a diabetic and you have neuropathy in your feet, why don't you go outside without your shoes on? Yeah, you don't go. You go outside with shoes on, because if you don't, you could cut your feet, you could sunburn your feet, you could have all these damage because you don't feel. Same thing. You're not feeling. You have to go, and so it fills up and you leak. So people say, yeah, I can live with that, right? Yeah, it's just part of the aging. My grandmother and my mom wore diapers and, whatever. Actually, it can cause problems, and it's not a part of normal aging. We can actually help this. One, as we'll talk about later, keeping your blood sugar under control, but there are things that can happen that are bad. Skin breakdown, infections. What's another thing about high blood sugars that with infections? It takes a long time to heal. And there's actually a big physiological reason, but I always just think it's because if your blood's so sweet and everything's so sweet, the bacteria are just like, ooh, I like this place. And they don't want to go away. They're like, this is perfect. I got food, I got oxygen. So, but diabetics do heal slower, and you can get infections, and really bad infections. And if you're leaking and the skin's breaking down, that can happen. Retention, again, not feeling, that neurogenic bladder. Retention can be very harmful. If you're letting yourself hold, a baby's worth of urine and it's backing up into your kidneys, you got kidney damage already from the blood going, and then you got them getting enlarged just from the backflow. And we want to avoid all this, and I'm sure everyone here, there's no one here going, I don't care, I want my kidneys to be failed. Of course not. Of course everyone's goal is to keep everything as healthy as possible, but just know that it can stem from the bladder too. Pain. So You know, you don't go outside without your shoes because you might cut yourself, but some people have a lot of pain in your feet and hands. That neuropathy can hurt really bad. You can have bladder pain and vulvar pain and genital pain, which is neuropathy. It's down in that area. So just think about that. If you're having pain in that area, it may not be a urinary tract infection. It may not be what you think, a yeast infection. That's the most common thing that women will think. It's a yeast infection. It may be the neuropathy. And again, actually pelvic physical therapy helps getting those muscles to relax. So there's a lot of things that can be done. But diabetes definitely causes damage way beyond the kidneys and other parts of the body. So the point of this slide is don't ignore the leaking. It can be damaging. Okay? I'm not just trying to create business for me and Dr. Lewis and the other doctors here, but just know that there are consequences to it, it's not just life. All right, I love this lady in her really high heels. She's very active and exciting. I wish she worked here. I don't know. I don't know what you guys would want to do. But so at any diabetic talk, I'm sure you guys hear the same thing. It's really important to keep your blood sugars controlled. Yeah? Do they end like that usually? Kind of, yeah. Really important, and it is. And staying active. Staying active, again, blood flow. I love blood flow. When you're active, even just walking or moving your arms. I mean, if your feet hurt too bad to walk, move your arms up and down. Get that blood flowing. It's healative. It gets oxygen to all those areas. If you can't move your arms, wiggle your legs. Have you ever done this because your foot's asleep? You're like, It's because it actually promotes the blood flow. It's easy, right? So easy to keep all this, right? Yeah? Yeah, simple. No, I know, it's not. Every day. You walk into Publix and there's those cookies with the frosting and they're like, buy one, get one free. I'm having a person over, maybe I'll get some, because I need 24 cookies for 2 people. It's hard, and we know that. All providers know it's really hard to do this. And I tried to put some healthy choices up here, using your medications, going to see your doctor, or nurse practitioner. Nurse practitioners are great for management, so just let you know. But we know it's not easy, and for instance, newly diabetic, so let's talk about the poly. I love poly. So polyuria, polydipsia, you're drinking a lot, you're peeing a lot. You go to the doctor and he says, I'm sorry, ma'am, you have diabetes. I need you to exercise more. And you're like, I am peeing myself. Do I really want to exercise? And you're thinking that, but usually we don't tell our doctors that we're leaking. Okay, I'll exercise. It's hard for many reasons because you have your bladder misbehaving already at the very beginning, right? You're filling up, you're peeing, you have to go at the very beginning, and then you're being asked to do all these things. It is very important. So again, urologists can help, pelvic physical therapy can help, getting that bladder under control can help you be more active, and that's so important. And active, again, not aerobics. Please don't try that. I don't even think I can do that. Just like, woo! But it was the best staying active thing. Like, there were a bunch of people running and biking, and I'm not a big fan of biking because it cuts the blood flow off. Think about it. Unless you can find one of those really cool seats that doesn't have any, or just stand up the whole time like they do in spin class. So pay attention to your bladder. It might be warning you of things if you're having to pee a lot more. It's actually a great indicator sometimes of high blood sugar. When people start, all of a sudden they're like, I'm peeing every 5 minutes. Check your blood sugar. I'm going to plug again. I love plugging Florida Hospital Zephyrhills. I think that this place is unique in many ways. It's a small community. Things like this are so special, and it's not in every community that you have this. But this is a terrible picture, I'm sorry, but the Wellness Center can help in so many ways. You have Cassio over there with his team to help you find things you can do, exercises you can do that are within your physical abilities. He's not going to say, well, let's get you on the elliptical. No, not everyone needs that. You may just say, let's just walk, or let me get you some light weights. We have Miriam, dietitian, fabulous. You got someone who can help you with food choices. I mean, this center really is wonderful, so utilize it. And I know they have a lot of free things like this. This is awesome. You don't have to pay for it. And again, the physical therapy, Reveli-Pelto. And you do need a referral for that, so you'd have to see somebody. But no, I'm just kidding. There's so much here to offer at Florida Hospital. So we're not done yet, almost. So the quiz, and I try to just make it easy. So in early diabetes, how is the bladder affected? Polly, gotta pee, gotta pee, gotta pee. Fills up. How does damage to the blood vessels affect function and health? Remember? It's damaging them. Muscles are getting weak because they're not getting enough blood flow. And then yes, sir.
You're talking about the sugar acting like sandpaper. How can cholesterol something build up if this is acting like sandpaper? Does it not?
Oh, that's a great question.
Ask somebody else.
No. I wish that it really did work like sandpaper, but that's really just an analogy. It's actually inflammatory too, and the inflammation actually will increase your risk for the cholesterol plaques. Luckily, there are things that can reduce the inflammation. Well, of course, keeping the blood sugar low, but the statins actually do help with the inflammation. Yeah, it would be nice if we could find something that would just sandpaper that stuff away, but then it would damage the vessels and you'd have inflammation. But inflammation is not our friend. As much as I love blood flow, inflammation is bad.
Well, it's the first time I've heard this discussed that sugar acts like sandpaper on the inside of the vessels.
Yeah, it's not rough like sandpaper, but if you think about it, it makes everything thicker. And that's especially like the kidneys and the eyes. You have these, tiny itty bitty little vessels, and then you're shoving a bunch of sugar through it, which is a decent sized molecule. And it really does just damage, and it just over time, it's like pouring syrup through something. Not syrup, something a little lighter than syrup. Maybe simple syrup. But yeah, it's just a little bit more than our vessels, the little vessels. Now here, these huge massive vessels, they can handle a little more. So you damage the blood vessels, damage to the nerves. What happens to the bladder's ability to empty? Yeah, sometimes you can't. People remember the catheters. I don't want a catheter. Please, I don't want a catheter.
Have they tried something with my heart electrically being stimulated? Have they tried something electrically to stimulate blood?
Yeah, I didn't pay him to be here, by the way. Yes, they do. It's very interesting. They have something called InterStim, and it's a bladder pacemaker. It's made by the same people who actually make the heart, some of the heart pacemakers. There's a lot of companies that make them, but Medtronic is the only one that makes a bladder pacemaker, and it actually is installed, I'm hitting my thing, it's installed in your hip, and it goes in through the sacrum, which are the nerves that go through the bladder, and yes, that can help. Now, that being said, if the nerves are permanently damaged, you can't kick, yeah. But you get, there's trials of it, so you can do a trial to see if there's enough nerve function there. It's kind of scary to think an implant and wires in my back and my rear, but it's actually very amazing, especially for patients who have, failed the medical therapies or physical therapy. I've always been amazed at how it helps, just to kind of because it basically is firing the nerve. Yeah. Yeah, you're so smart. This guy's smart. So this lecture, Diabetes and Bladder Function, is brought to you by the letter P. If anyone gets that. Any questions about diabetes, your diabetes, anything specific to you and your bladder function? Maybe something's happening in your bladder that you're not sure.
Green sugar?
No, and actually I tried to find a little molecule sized, and it's hard. The internet isn't good for everything. Yeah, no, be careful. Be careful. Anything? Comments?
Now you hear a lot, heard on television advertised where diabetes is reversible. They don't tell you which one.
They don't tell you. Yeah, you cannot reverse. Well, the two, and this isn't part of my talk, I know, but the two basic types of diabetes, the way that I explain it, you got the one, type 1 or juvenile onset, they keep changing the name, where your pancreas doesn't work and doesn't produce insulin, so you have no insulin. Unless they gave you a pancreas transplant, which I don't think they do, no, you can't reverse that. You can take insulin, And actually, as a provider, that seems much easier to manage than the insulin resistance, which basically means your cells have been inundated with so much sugar that the insulin, it's just not working anymore. It's like using a key a bunch of times and it starts to wear down, and then the key's worn down and it's not letting the sugar in. So the insulin resistance, now is that reversible? I will tell you, look up some studies on these women and men who've had gastric bypass. It's very interesting. Their diseases like high blood pressure will go away. Diabetes improves dramatically. Weight loss actually it does help. I wouldn't say cure. You're still susceptible to it, but yes. Yeah. But don't, yeah.
You're talking about type 1, right?
Type 2.
Oh, type 2.
Type 1, no. There's no cure to type 1, as far as I know, unless somebody has research. But
type 2 under good control, diet, exercise.
Yeah, well, weight loss, and I mean, yeah. Fat cells are actually inflammatory. Remember, inflammation? I hate inflammation. They're inflammatory, and they're linking actually a lot of things with that. And there's actually some new things coming out about what came first, the obesity or the diabetes. So keep an eye out for that. Yes, sir.
What actually should your blood sugar rate be?
Oh, goodness. I'm going to tell you that should be between you and your provider. I'm a very concerned, as a urology nurse practitioner, I don't manage blood sugar, but I will tell you that they're finding more and more that, your fasting blood sugar should be closer to 100 than 200. And really there's no normal for me, like high blood pressure. There is actually a range. 2 hour after, some people do the 2 hour after, an hour after meals, less than 200. But that fasting.
Under 140 after 2 hours after.
No, they say no more than 140? That's great.
And a blood sugar
Yeah.
between 70 and 100.
In a diabetic?
Yes.
Yeah, because fasting, anything above they changed it, like 100, 120. Yeah, if you're 123 fasting, it's diagnostic. You're diabetic. If you fasted. Please don't fast after you had donuts the day before. Yeah. It does matter what you ate the day before. But yeah, strict control is key, and I love this new it's not new anymore, the A1C test, because you can't really cheat it. And I think that is actually having people have better control, which is great. There's nothing like being held accountable, which is why Weight Watchers works, because you're held accountable. Anything that you're going to weekly or monthly. So, any other questions? You guys, this is wonderful, this type of a group. Does anyone have anything to cheer? Do you guys do snaps? Anyone have a wonderful thing happen this week? Huh? You can't do that? Any claps? Yeah. Nobody? I paid it, yeah. He wanted to point out that I was being insensitive. No, that's fine, that's fine. No, you didn't. I thought I'm going to run over this gentleman, and then I'm going to see him.
I knew I was going to see you if you went past me. I said, I've seen her before.
But I'm hoping that from this talk you did get some new knowledge about how diabetes affects things other than everything you always hear about, the eyes, kidneys, and how it does affect your bladder. So thank you again for having me. I'll be here if you have any questions, and thank you.
Didn't realize that neuropathy affects it like that.
Mm-hmm.
Just about the feet and the hands.
Yep, it can affects the bladder too.
Feet and hands.
All right, thank you.